Our next presenter is Eric Felix Lyimo from the National Institute of Medical Research in Mwanza, Tanzania. So Eric, please go ahead.
Thank you. As Jessica said, my name is Eric Lyimo from the National Institute of Medical Research in Tanzania, Africa. And we did this work in collaboration with Copenhagen University and the Danish Technical University of Denmark. So what we did in our study, we recruited children from a village where malaria severity is high, and we recruited health and the sick children, sick with malaria and of course other diseases, and we compared the Glycocalyx and the frequency of hemorrhages. Next slide, please. So what is the Glycocalyx? The Glycocalyx is the layer which covers the inside of the blood capillaries. So it prevents, the unwanted adherence of blood cells in the endothelial cells of the capillary lining. So this is the Glycocalyx is a carbohydrate-rich layer of carbohydrate-rich layer which protects the blood vessels. So we all know that falciparum can cause severe malaria, and severe malaria is associated with systemic inflammation and the endothelial activation. So we hypothesized that severe malaria will cause the erosion of this layer, and then other severe, episodes of malaria will appear, like infected blood cells adherence. So in this study, what has been done is in experimental malarias, where it has been shown that malaria severity and Glycocalyx loss appears in the blood, in the brain vessels. Next slide, please. So what we aimed is we are trying to look if pediatric malaria will be associated with Glycocalyx, which will cause, impairing of the microcirculation. Microcirculation is the blood flow system in these smallest blood capillaries. So we have macro and the microcirculation. Here we determined the extent to which microcirculation will be impaired. So we used a state-of-the-art and an invasive method where we imaged the buccal mucosa. Next slide, please. So when I say that we image the buccal mucosa, we use this CytoCam-IDF tool from Bridus. This is a company from Netherlands. So you can see on your left side, a cytochrome probe. This is a pen-like device which was inserted between the inferior lip and teeth, where we image the videos of microcirculation. So when we recruited these children, we took 3 or more videos, and also we took blood samples. So from the blood samples, we determined the Glycocalyx markers, of course, and other parameters like endothelial dysfunction markers. So we used the ELISA to determine the Glycocalyx markers from these blood collected samples from healthy and from sick children. So when we measured the Glycocalyx markers from the infected children, we also compared it with the thing called PBR. This is a perfused boundary region. So on your right side, you'll see the perfused boundary region is the median column, of blood flow. So this perfused boundary region, when a child is infected with a disease which will cause them, a child or anybody who is infected with a disease, the Glycocalyx will be eroded, and then the PBR will be widened. And sometimes also the blood capillaries will rupture and cause hemorrhages or other things. So next slide, please. So our findings, as we can see here from some of our findings, on the left side is the blood pattern of healthy children, where you can see a clear pattern of blood cells. And here the blood flows. This is just a snapshot, but this was a video. And here the blood cells were flowing good, and also the nutrients and the oxygen will be delivered effectively. But on the right side, this is a snapshot of one of our findings where this was a severely sick child, and you can see even the volume of blood is not that good. Also, the vascular pattern is not well defined in these severely sick children. So this underlines what is happening in some organs. So as I told you before, these are the snapshots of video from the blood flows from the interior limb, chin, and teeth. Next slide, please. So CytoCam-IDF this is the tool that we used. It really well revealed the Glycocalyx loss. So from the plasma analysis, we saw that that the PBR, which is the inverse measure of Glycocalyx, was associated with malaria, and here all forms of malaria. Also, we found that hemorrhages were more prominent in severely sick children. So almost half of children who had hemorrhages were severely sick with malaria. Next slide, please. We also tried to find out if PBR and hemorrhages will be restored to normal levels after malaria treatment. And we followed these children for about 28 days, where we had 2 measurements. And on your right side, you can see that PBR was reduced, meaning it was get back to normal. So even after the 28 days, these levels of PBR were comparable between healthy and sick children children who were sick. And on your left side, these are the frequency. This shows the trend of hemorrhages after treatment. We can see that, on the dark line, we can see that this is the average, lowering of hemorrhages. It was quicker in children with uncomplicated malaria than in children with severely malaria. Meaning that those people who were severely sick took a lot of time to recover from hemorrhages. Next slide, please. So from the plasma measurement of Glycocalyx, level of Glycocalyx markers, and Glycosaminoglycans are one of the components of Glycocalyx, we saw that, a marker like the sulfated Glycosaminoglycans were more elevated in only severely sick children. That was also the case for plasma hyaluronic acid. This is the most prominent measured Glycocalyx marker. But a marker like heparan sulfate was also, upregulated in, was also increased in uncomplicated malaria. Next slide, please. So another component of Glycocalyx are the proteoglycans, and these are the selected proteoglycans. Not all of them had different levels between healthy and sick children. But here we can see, like syndican 1, this is one of the mostly, measured Glycocalyx marker. It was associated with all forms of malaria. But glypican 1 was associated with only severe malaria and also non-malarial fevers. The non-malarial fevers are mostly where the bacterial infections, and some other studies have also found the same pattern, that glypican can also be elevated in bacterial infections. Next slide, please. So we also determined how the extent of dysfunction of endothelial lining of the blood vessels. So we saw that we measured some few markers, and we can see angiopoietin 1 and angiopoietin 2. These are antagonistic markers which are maintaining the endothelial coenzymes. They were associated with severe malaria, and mostly angiopoietin 1 was exclusively, deregulated in severe malaria. Also, endothelin, this is a vasoconstrictor peptide, was also only elevated in severe malaria children. And also thrombomodulin, this deals with coagulation, was also associated only with severe malaria children. And all these markers, they are embedded in the Glycocalyx markers, in the Glycocalyx matrix, especially the thrombomodulin. Meaning, as the layer is lost, the Plasmodium is also elevated, meaning also the, disturbance of the coagulation cascade. Next slide, please. Next slide. So we also did some correlation. So we wanted. 2 minutes. Okay, thank you. So we wanted to see if there will be correlation between Glycocalyx markers and this dysfunction, and this was the case. Next slide, please. Also, there was a correlation between endothelial dysfunction, Glycocalyx and Glycocalyx markers, and hemorrhages. We can also plasma protein 1 could predict hemorrhage frequency. At 20 nanograms, we can see that we saw that the hemorrhages started to appear. Also, the profuse boundary region correlated with plasma hyaluronic acid, meaning that what we saw in the videos, that the PBRI was increasing, was also reflected in the plasma by the increase in hyaluronic acid. Next slide, please. Also, we saw that these markers were also associated with signs of severe malaria. Like plasma hyaluronic acid was more, in children with convulsions, and also heparan sulfate was elevated more in children with convulsions. Next slide, please. So in conclusion, you can say that Glycocalyx loss, which is associated with malaria, so meaning that the layer which covers the endothelial lining is eroded in severe malaria. Also, the images demonstrated that microcirculation is lost by the formation of hemorrhages, meaning the Glycocalyx is lost, then microcirculation alteration appears. Also, the increase in PBR demonstrated loss of vascular Glycocalyx from the buccal capillaries. And this was correlated between what we saw in the videos. There was a correlation between what we saw in the videos and what we saw in the plasma analysis. Next slide, please. Next slide. So here we recommended this to be done also in adult patients, and also there were challenges in acquiring these videos because they are very difficult. To make the children settle, and this work has been published at the Infection and Immunity, volume 8. Thank you.
Great. Thank you so much, Eric. That was really interesting. I have a quick question myself, and sorry if I missed this, but what ages were the children in this study?
So the children were between 2 and 12 years of age, but what we got mostly were between 3 and 7.
Okay, great. And then there's a few more questions in the chat. So when the proteoglycan is elevated in the plasma, can this generate a problem in the coagulation cascade?
So we didn't measure the coagulation, from these children, the coagulation disturbance, but that's our theory.
Okay. And do you have any plans on looking at that in the future?
Yes, we have plans looking at features like we want to establish normal ranges when we use these devices, because there are some parameters which I didn't say here for the microcirculation. Also, we want to expand this study to adult studies to see if what is happening in children is also happening in adults, though adults do not have severe, malaria.
Okay. And as far as the mechanism of how the loss is occurring, do you think the Glycocalyx loss is caused by the binding of infected red blood cells or by inflammation? And a second part, do you expect the sequestration in the buccal vessels?
Yeah, so starting with the first one, what we think when the inflammation when the inflammatory response occurs due to Plasmodium infection, this is when the proteins which eroded the Glycocalyx appears. So from some studies, they say that there are some enzymes, also the elevation of these markers of inflammation also are associated with Glycocalyx loss, but not from the infected red blood cells. But after the infection is the inflammatory response that caused the Glycocalyx loss. So shedders and proteases might be eating away this layer as a result of Plasmodium infection. Yeah. And the second question, come again?
The second question was, do you expect sequestration in the buccal vessels?
Exactly. So what I didn't show here, what I couldn't share is one of our videos, we captured in real time, a sequestering parasite. So even the buccal and even the buccal capillaries, sequestration may appear. So that was a strange thing. So I couldn't share here, but sequestration may also appear, can appear also.
Oh, okay, that's good. And then did your findings correlate with malaria retinopathy or multi-organ involvement? And did you do any follow-up imaging?
Come again?
Does your findings correlate with malaria retinopathy? Is it the same, similar mechanisms?
Yeah, we could say that because here we have only Plasmodium falciparum malaria, so we can say about that. And here we targeted severely malaria children, and this appears only in falciparum malaria, so we can say about that.
Okay. And there's a few more questions. Can you relate the endothelial damage with any stages of parasites in circulation? Are there any schizons present?
Yeah, I think so.
Okay. And do you think other infectious diseases would cause these same problems in the Glycocalyx?
Yeah, we actually in some other studies, bacterial infection can also cause the Glycocalyx changes. So what we did in this study, we excluded all those with malaria plus other infections. So the ones that we measured here are only children who are infected with malaria. It's known that bacteria and heart disease may cause Glycocalyx damage. So here, these are one of the first studies to show that severe malaria can also cause Glycocalyx damage.